as we're doing the updates of the 2014 budget, bringing you up to speed on all the reactions that we're getting. We've had economists, we've had people to touch on the particular issue. We'll go out there and get some views for you shortly.
You earlier suggested that 10% salaries be cut. The finance minister said Pepe, mentioning that 10% salaries have been cut. Is this something that you say that government perhaps might have taken your earlier suggestion to consideration?
Well, maybe so, but I suspect that they already knew that they had to do something, except that perhaps they didn't have the credibility to say it. And so when I said it, in a way, I said it for them. They knew. I mean, they know what they have to do. But they are the same people who instituted a single spine system the way they did. And so how do you come back and say that we should now give you back some of the money? You didn't know what you were doing. That's the problem. But we have to do it. We have no choice. That's not matter how they did it. We have to do it. And what they've done is not exactly what I said. What they've done is, people are calling it cosmetics. But I suspect it's just the beginning of it, that they have cut their own. The political appointees present. As a matter of fact, I've said that the president actually, we can't cut the president's salary because the constitution does not allow it, which means in this case he has to donate the money. But if he gives it to us, then it's okay. The others, yes, we can cut it. But the political appointees have been affected now. I suspect maybe come January, now they're going to tell the rest of us that we too have to sacrifice. Right? But it's not enough.
Now, your worry is saving the national economy. I mean, with this move, will you say that it is going to put the economy in a very good grounds?
Well, not yet, because what they've done, actually, the money they are going to save is not going to pay any debt or anything like that. It's going to a health service. And so it's not tackling that at all. As a matter of fact, it can't tackle it because it's too small. The big gorilla is the single spine. That is where the big money is. And so that is where we need to see the action. And they haven't done it yet. That's what I'm saying, that I think they are going to do it. But they have more credibility if they have done it to themselves first, before they ask others to sacrifice. Yes.
I know you have more issues to raise as far as the other areas are concerned, but let me shift to Dr. Ernest Kwakon. You must be a very content man now because of the fact that we have barely 2 years to hit 2015, and seeing government making a commitment to improve maternal and then child health, perhaps it's a step in the right direction.
I am excited that something will be given to help beef up community-based health planning services. That's the lowest unit of healthcare delivery that we can give to mothers and children. I'm excited, especially in trying to achieve Millennium Development Goal 5 based upon preventive family planning health, which will actually potentially cut down the number of unintended pregnancies and therefore unsafe abortion and therefore needless maternal death. Potentially, if we are able to improve access to reproductive and family planning services, potentially we can cut down maternal mortality burden by about 10%. So it's a wonderful idea. If you look at the estimate that the finance minister gave, you are looking at about 80,000 Ghana cedis per month. That is if all the appointees are able to give up 10% of their salaries. So in a cursory estimate for a cheap zone that has a small outlet facility to attend to patients, it has accommodation for the community nursing officer or the community health officer, and then maybe a laboratory and a few other places to store medication and essential drugs. We are looking at maybe possibly 10 cheap zones constructed in a year. Okay. That would be something. But my only prayer is that, look, there will not be legal, stakeouts to make it difficult for us to realize that 10%. Because is it a committee that is suggesting the 10% cut? Is it coming to their hands so that they give it? Because as far as I'm concerned, if you are going to deduct it as source from the contract accountant general, there will be a problem. Because there has to be a committee that suggests these salaries that are adopted by Parliament. And until the finance minister explains how it is done, then In whose hand is it going into? We understand I said a dedicated fund. How is it going to be tracked? How is it going to be monitored? How are we going to make sure that it is efficiently put to the use to the chip zones? It's a bigger sacrifice other than the 10%. I agree that it's a tokenism and it's a right direction. If people see that the executive are actually sacrificing, then we're all inclined to tag along. But the bigger sacrifice I have, as I always said, is the needless leakages in our finances through the ministry, department and agencies, and then through tax under declaration, through under supply from the GRA, through under disbursement from the executive, from the consolidated, through under from ministry, department and agencies and project contractors. This is where our huge leakages are. We can make a lot of savings if that happens. We would like to see some sacrifice from that direction as well.
Which areas also caught your attention, and what do you think there was kind of something that they could have done to improve that very sector?
Well, just a small area with respect to university professors about book allowance, that they're going to set up a research fund or something like that. That is a non-starter. You don't do things like that this way. You have to talk to the affected people first and come to some consensus before you put it there as an official information. If you do this, you're just asking for unnecessary strife because they won't agree. Now, if you came to them and talked to them, maybe you would have met at the middle ground somewhere, and then you put it in. Now, why don't they ever learn from these mistakes they've done in the past? Right? The other thing is this: the main problem is, look, the economy keeps going down, the dollar keeps rising, right? And so we are losing our savings, we are losing. Food prices going up, not because food is in short supply, but because the dollar is getting more expensive. We are importing food from Burkina Faso and Ivory Coast, and the rest from China, almost everything to toothpick and condoms, right? And we have to pay attention to this. There has to be a plan. You don't have to have money to change things. Just a good plan is good enough to make investors and the stakeholders a bit comfortable. Yes, now your plan is good, and if you follow through, it will work. I haven't seen it yet, right? That is very, very important.
Okay. Doc has not seen any plan to drive in investors. Doc, briefly, what do you also make of the other areas that some resources were also allocated to?
Briefly, Evans, look, I listened to the budget. I have tried to read portions of it. I'm not on top of it yet. But it doesn't really depart from all the other 8 or 9 budgets that are followed closely now. I think describing as rising to the challenge budget is appropriate because we are heavily challenged. But I don't know about it being transformational.